Welcome, gentlemen, to this week's HT FAQ. Tonight, we're putting FUT and FUE head-to-head in this 12-round heavyweight matchup. All right, well, some of you know that I've had 2 hair transplant procedures. My first one was in January of 2017. That was an FUT strip procedure of 2,500 grafts. My second procedure was in October of 2020, just 4 weeks ago today, and that was an FUE DHI 3,200 graft transplant. At the end of this video, I will tell you from my own personal experience why I chose to do each, and if there's anything different that I would have done if I could go back to 2017. So without further ado, let's get ready to rumble! Well, welcome back and thanks for joining me on HT with Dave. Okay, so FUT, follicular unit transplantation, and FUE, follicular unit extraction. These names are kind of confusing, and that's because the way in which the hairs are actually transplanted into the recipient sites can be identical between the two methods. So what we're really looking at here is the way in which the hair is harvested from the donor sites and how those methods can affect things like pain and recovery and cost. So just a quick overview, FUT, also known as the strip method, gained popularity in the 1980s and became the dominant choice all the way until the last decade. It is still very prominent today and is the preferred choice of many experienced surgeons. It relies on the natural flexibility of the scalp to cut a strip of hair from the back of the head. That strip is typically about 1 centimeter wide and it can extend around the sides of the head depending on the number of grafts needed for the procedure. That strip is then removed, cut down into individual follicular units. The wound is closed and stitched, and the hairs are then transplanted into the recipient sites. All right, FUE. This method really began to take off in the early 2000s, but it actually got its origins from the early days of the 1950s and 60s. My God, am I glad they're not still using those 5mm punches turning us into Cabbage Patch dolls anymore. But nowadays, the tools have become smaller and the results look a lot more natural. The process is simple. Miniature punches less than 1 millimeter wide individually remove the hair follicles in a scattered-like approach. Now, the FUE method requires a larger area to harvest from, as taking more than 30 or 40% of follicles in any given area could leave the donor sites looking thin or unnatural. One of the unique things about FUE is that the technology continues to evolve. Some clinics are using specialized machines and even robots to complete the extraction. Also, special implanter pens can be used to extract the hair and then directly implant that hair into the recipient sites. That is called DHI, or direct hair implantation. Okay, so over the past decade, FUE transplants have become more popular than FUT transplants. Is it because it's a superior technique? Or is it just the latest fad? Well, let's get in the ring and find out who's the true champ of 2020. I look ridiculous. Round 1, visible scarring. All right, well, this one might seem obvious as you've got a lot of surgeons promising FUE as a scarless procedure. And it really comes down to how short can you wear your hair and it still look natural or not obvious that you've had a hair transplant. Okay, so with FUT, you get that single linear scar. It's about a pencil line width. It goes along the back and the sides above the ears. Now with FUE, you get those scars, but they're dots and they're kind of peppered throughout the donor site. If you were just to compare 2 procedures side by side, a 2,000 graft FUT and a 2,000 graft FUE, the FUE would likely win hands down in terms of visibility of the scar and being able to wear your hair short. But the big thing I think to remember is here, FUE procedures continue to reduce the density of the hair in those donor sites. And what I mean is, over time, if you were to have multiple procedures or large procedures, over time, the hair actually becomes less dense and can look patchy. And having shorter hairstyles can make that patchiness more obvious. With FUT, you're not actually reducing the density of the hair in the donor area. You're simply reducing the elasticity of the scalp. So second procedure, they're simply cutting another strip, sewing it together, and the donor area still has 100% density. So it could be harvested very easily for another FUT or an FUE. The issue with FUE, once you have 2 procedures or a large procedure, your density just goes down. So if you were to then change and do an FUT procedure, that strip would not be 100% anymore, right? Because you've already taken from that area a little bit. So it's not efficient. And even more so, you're not just worried about, at this point, covering those little dots and those little scars, but wearing your hair short will actually show more of an obvious patchiness look. A good surgeon should hopefully avoid this, but you can't avoid if you're trying to do several procedures and get lots of grafts with FUE, you'll actually start to see an unevenness. And I'll show you right now. This is about a 2 guard right here on the side. And I know that because the linear scar is almost hidden. And this is about what it looks like at a 2. And when I say this, the appearance of my hair in the scalp, actually I can tell is thinner, right? And it makes sense that they've harvested hair from it. So if you can see through a little bit more, imagine doing more of these procedures. It would actually potentially give way to a more unnatural look. And we're not just talking scarring, we're talking an unnatural look. So something to consider, but FUE wins. Round 2, hair loss in the crown area. So the FUT strip method moves 100% of the hairs from a relatively small area, the safe zone area really, and I call that the Bernie Sanders zone. It's not going anywhere. So for patients that have severe hair loss, or primarily their hair loss is in the crown, it could really help actually move a lot of hair a safe distance away from the balding margin and away from future hair loss. Another correlation to this would be if you're quite young and you're already seeing advanced stages of hair loss. Getting an FUE procedure could be a mistake. These grafts are taken from a larger area closer to your balding zones. So you may in fact be transplanting hair that is not permanent in its new location because that hair was already genetically destined to leave your head. Harvesting an area that looks okay today and might be susceptible to hair loss in the future could be risky. And for that reason, FUT wins. Round 3, small sessions or small areas of hair loss. Now, if you're older, maybe in your 40s or 50s, and you've got that receding hairline maybe just in the corners, that's where FUE can really shine. FUE only takes the necessary number of follicles for any given procedure. So that just means less harvesting and less scarring. With FUT, there's always going to be a linear scar, regardless of the size of the procedure. So for this reason, FUE wins. Round 4. First or multiple procedures. You know, this one I didn't really think about when I got my first procedure, and I think it's probably true for most guys that we all just think we'll only get one hair transplant and it's going to look amazing and full and better than the pictures promised. And I think this can be especially dangerous for younger guys in their 20s and 30s. And yes, there are guys that report having excellent results after having only one procedure, but I think it's also important to consider the possibility of having more. An interesting statistic in 2019, according to the International Society of Hair Restoration Surgeries, 57% of patients being seen for hair transplants were in there for their first procedure. 33% of them were for their second procedure. And that's a pretty high percentage. So if this is your first procedure, and I think if you're younger or you have substantial hair loss, an FUT might be the better way to go. And again, that's because you're not reducing any density from the back of the head. You're simply just reducing the elasticity of the scalp, allowing for more future transplant procedures. There are some FUT patients that have reported up to 5 transplants. And although that seems excessive for me, it's, I guess, nice to know that that option was there for that individual. If you choose to have an FUE for your first procedure, it could be a mistake if you end up having future procedures. Over-harvesting the donor area in the back could leave your hair looking patchy and thin. And if you decide to change and do an FUT procedure in the future, it will be less effective. And for this reason, FUT wins. Round 5, thinner or less dense donor hair. All right, for this one, this really just looks at a person's individual hair type. And unfortunately, not everyone is a great candidate for a hair transplant. But for those borderline hair transplant candidates, FUT may be the only option, as an FUE procedure may leave the hair in the back looking see-through. And for this reason, FUT wins. Round 6, pain during procedure. Okay, so for this one, when you look at the difference between FUE and FUT, FUE obviously uses a much larger area to harvest from. And so it's no surprise that they need to numb those areas. So with the area being up to 5 times larger than an FUT area, you have a significantly higher number of injection sites. And for me, for my recent FUE experience, it was about 40. I will say though that the first dozen were the most painful, and then as that anesthesia kind of carries through the scalp, by the end of it, I don't think I was really even feeling the last 10 or so. Now, there were topical numbing creams that they offered at an additional cost, but when you consider that the entire process is only 5 minutes, I didn't really see the value in that. So for someone like me who has a fairly high pain tolerance, it just wasn't a deciding factor with getting an FUE over an FUT. But in this case, the winner is FUT. Round 7. Initial recovery. All right, so after having an FUT procedure and having an FUE procedure, this one really stood out to me. And so just putting it out there, an FUE, you can anticipate a much quicker recovery and getting back to the activities that you're used to doing. So we'll just go over a few things. With FUT, you have stitches. Those can last 10 to 12 days before they're removed. But during that time, there is for me at least, a tremendous amount of pressure or tension on the scalp. So it's quite uncomfortable, especially when sleeping. Even just turning my head from side to side, I could feel the tension. But sleeping was the worst part. And I remember just being incredibly uncomfortable for that entire 10-day stretch. And when you're not sleeping well, it just adds to the whole irritability and miserableness of that whole experience. So that was definitely the worst part of the FUT surgery, I think, was the stitches and that tension. I've got a fairly high pain tolerance. I've got some tattoos, and I'm usually way too damn late to seek medical attention when needed. You can talk to my wife about how I refused to go to the hospital for my perforated appendix. It wasn't just about the pain, but it was just mostly about being uncomfortable all the time, and that just wore on me a little bit, especially with trying to get sleep. Another factor too is that you have to be very careful about your movements, and you're not supposed to be able to work out or lift anything heavy for several weeks, even they can say up to a month or more, to prevent possibly stretching that scar on the back of the scalp, which of course would be one of the worst things I think that could happen for an FUT surgery. The stitches will have to be removed at some point within those first 2 weeks, and that often requires another visit to the clinic or having to find someone locally, which can be an inconvenience. For me, I was fortunate enough that my sister-in-law is a nurse, so she was able to come over to the house and remove those stitches for me. Thank you, Sammy. So in both procedures, you will need to sleep elevated for the first couple nights. You will have some bleeding coming from the donor area. I will say there was a noticeable difference here. With FUT, there was quite a bit more bleeding along that stitch line. You'll want to wrap your pillows in, for me, I think I used a dark sweatshirt just to prevent any blood stains there. But all in all, I remember just getting back to normal activities and getting back to sleeping better with the FUE procedure. So for this one, it's an obvious FUE is the winner. Round 8. The appearance of the donor area immediately after the procedure. Okay, so this one's kind of interesting. One of the advantages I think most people think about with FUT is that they're not required to shave the back of the head before the procedure. So I think the common misconception is, well, then it'll look perfectly normal and I can go back to work sooner. Unfortunately for me, and I'll share with you my story, that's not really the case. And it's two reasons, I think. One, the team that actually cut the hair, it wasn't a perfect strip, right? I mean, unless they were very, very careful, it's not going to be a perfect, long hair to long hair line. There was some unevenness, so it looked like someone got me with the clippers in a couple spots. But I think the biggest reason is, even if they're super careful with the haircut and the stitching there, the front is still going to be obvious. And for me, for my first procedure, I had redness for several weeks, and I'm still, this has been 4 weeks now, and this FUE, it's pink. So even though it's not unsightly, I would say that, if you think you could return to work within 3 or 4 days, you're gonna have little scabs and crusts no matter what procedure you have. So I think it's important to be realistic and just know that for the first couple weeks, you're gonna look like a freak no matter what. And that first week, you're not even allowed to wear regular hats. So you're going to have that frontal area exposed regardless of which procedure that you go with. So it becomes kind of a moot point if you're just trying to cover up one area. I think it's still going to be obvious. So in that case, for me, I don't think it should be a real deal breaker, but I suppose after the 1 week mark and you are able to wear a hat and you want to return to work, you could probably hide an FUT surgery better than an FUE. FUT wins. Round 9, technological advantage. Okay, so regardless of which technique you choose, whether that be FUT or a conventional FUE procedure, they both have identical means of implanting the hair into the recipient sites. It's typically a two-step process where slit incisions are first made into the scalp, and then forceps are used to transplant the hair into the recipient sites. These incisions are typically larger than the graft itself, which can cause additional trauma and bleeding and recovery time. But when special tools are used during the FUE extraction, it can allow for DHI, or direct hair implantation. With DHI, they can use special syringe-like hollow-bladed pens to extract the hair and then directly implant those into the recipient sites. The incision and placement are done simultaneously, allowing for less trauma, faster recovery, and closer placement of the follicles. FUE has the advantage here, as implanter pens can only be used with the FUE method. So it's obvious, FUE wins. Round 10, transection rates. So it's important to break down the hair itself. The hair shaft is the part that's not living, but the hair follicle is the part under the skin. And if a surgeon were to karate chop one of those in half, that hair would stop growing, and there's no way to undo that process. Transection rate data varies widely, and it's mostly dependent on the surgeon and the tools used. But research shows that there's usually a 1 to 3% transection rate for FUT procedures, compared to a 5% transection rate in FUE procedures. So that might be an excellent question for your surgeon. What are your current transection rates? Now, if you're considering an FUE procedure, just know that the smaller the instruments they use, if they're using a 0.7 millimeter or a 0.6 millimeter punch, yes, that means you can get a higher density in that recipient site, but if not used correctly, that could lead to much higher transection rates. So for this reason, FUT wins. Round 11, price. Okay, so starting out with FUT, it is an older procedure and there are less variants, like FUE has DHI. FUT is primarily all done the exact same way. So the surgery times are also quite a bit less. And typically FUE procedures are more labor intensive, but there are special tools and training and even machines that can make the whole thing a lot more efficient. Some clinics that offer both FUT and FUE procedures may have different pricing for each, and it's usually because they specialize in one over the other. So just be careful. There are FUT clinics that charge quite a bit more for FUE, and vice versa. All in all, this question is kind of a difficult one to answer. I can say in the United States, typically FUT is the cheaper option. However, if you're willing to travel like I did to Turkey, FUE and DHI is quite popular and very affordable over there. So I'm just gonna go with, it's a perfect tie on this one. If you're able to really do your research and travel, I think once you find out which procedure is right for you, you can find one at an affordable price. Round 12, versatility. All right, so this is really kind of cool, but with FUE, surgeons are able to kind of cherry pick where they want to take those hairs from. So if there is an area that is just denser than others, they can target those areas. They can also, it sounds crazy, but they can actually harvest hairs from under the beard and even the chest hair. So if you are having an FUE procedure at those clinics and they need more donor hair, you've used up everything else, it is possible, if you have the right hair type, that you can go ahead and have them transplant the hair from those other areas into the scalp. So another cool thing about an FUE procedure is it can be used to actually hide an FUT scar. They can take those individual hairs punch by punch and then put them along that line to better hide that. So it's not something I was able to do. My recipient sites were too large and I ran out of grafts. But if it was possible, that would have been a really cool thing for anyone who has an FUT procedure and then follow that by an FUE. You would maybe have that option to fill in those spots and repair that scar line. For this reason, FUE wins. And the winner, by decision, FUT. Okay, so that might not seem fair. And any one of those pros and cons may be deal breakers for you. So I think it really comes down to your particular hair loss and your own personal preferences. However, when it comes down to it, FUT is more universal. It has a higher pool of good candidates. It yields the highest volume of hair for the smallest area in the safest area. So it's great for future hair loss or future hair transplants. And if you're in your 20s or 30s, you should be thinking long-term, and giving yourself more options in the future can be invaluable. So I guess my take on all this is everyone's hair loss is different. In fact, my hair loss pattern was different than anything that could be found on the Norwood scale. So whereas I had very little balding on the apex or crown area, I had a substantial amount, as you could see, in the temples and the receding forehead. And so because of that, my procedure was not small by any means. And I think I really underestimated that during my first procedure. I think everyone thinks their first procedure is their only procedure and that the results are going to be better than they anticipate. So I just want to at least say that keep your mind open for the possibility of having a second procedure. So I was a good candidate for both procedures. I have a large donor area with great density and a lot of flexibility in the scalp. I also didn't typically wear my hair on the sides and the back less than a 2 or a 3 guard. But when it all came down to it, the size of the procedure was really the deciding factor. In most cases, an FUT procedure will give you the highest yield in one procedure. Now there are exceptions to that. My DHI procedure in Turkey gave me 3,200, but that is definitely not typical, and you do run that risk of over-harvesting the areas around the sides and the back. But when it came down to wanting to have a second and final procedure, because I was noticing a lot of gaps in between the hair follicles in the front, and it was mostly a problem when my hair was wet because I couldn't cover up those areas with topical fibers. Basically, I wanted to just really get the density up, and the only way to do that currently is to use a direct hair implant method. So that is the reason I chose FUE DHI, the second transplant. And if you look at the photos of my first procedure, my FUT, and my second procedure, the DHI method, you can really see the difference, seeing just exactly how close they're able to get those grafts. You know, I think with that first procedure, doing an FUT allowed me to capitalize on that elasticity that I had in my scalp, which is definitely an advantage when you're younger. So, you know, I think that was an advantage there. I was able to at least establish the hairline, and then with the FUE, get the density in there. Now, no one really knows where their hair loss is going to go when you're 20 years old. And there's definitely preventative measures, which I've talked about in some of my other videos. But I think when you are younger, it's good to plan for the future. If I knew that I would have 3 procedures, I probably, if I were to choose now, I would do FUT, again, another FUT, and then finish FUE. And I think just because I definitely still have some flexibility of the scalp, but at this point doing an FUT after the FUE, I know how thin the area is already, and I just don't see the value in doing that necessarily. So yeah, I guess that would just be one thing of advice. If you have a lot of area, I would say hammer in the FUT procedures up front and use that elasticity in your scalp, and then look into FUE to allow maybe a DHI method that can get the density in those areas that are still thin. Okay, so as I mentioned, it's been exactly 4 weeks since my FUE DHI procedure in Turkey. Just wanted to give you a quick update here. The hair on the back and the sides are now at about a 2 guard, although I will say it is noticeably thinner looking. They took a lot of hair, so just getting used to that, but you can tell the scars are a lot harder to notice. Mostly it's just that linear scar, and the sides are probably the thinnest area, so that's where I see it the most. The back, well, you can see it better than I can. So you can see the faint linear scar. I did notice though that the top of the haircut, where they actually took a lot of the grafts, it is thinner. And when looked at the top area of the crown, it's a denser hair up there. So right now it's almost an obvious line that you see, and I'm not sure exactly how that'll develop. Hoping that kind of fills in and balances out because the length of the hair is actually the same. When I put my hand on it, I could tell it's just a different density. So we'll have to kind of stay tuned to see how that turns out. What else? Oh, next week I will be growing my mustache out for Mustache Movember. So that'll be epic. Stay tuned for that. Well, that's it for this week's HT FAQ. I think the most important takeaway from this week's episode is that there is no one procedure that is the best for all cases. Each method has their own unique advantages, and I'm certainly glad that we have the ability to be able to choose from both of them. According to the International Society of Hair Restoration Surgeries, hair transplants are the #1 cosmetic surgeries for men. But just remember, your donor hair is finite. Once it's gone forever. There is no undo button. So you better as hell trust your surgeon before you have any procedures. Do your research. And my last bit of advice, don't be afraid to travel if necessary. Okay, so if any of you have had one or both of these procedures or just want to share your experience, I'd like to hear from you. Please leave a comment down below or feel free to personal message me. By the way, I'm really enjoying this series and writing these episodes. If this is something that you like to watch, don't be afraid to hit the like button and reach out to me if you have questions. And finally, if you haven't yet watched my 2-part series of my hair transplant documentary, my travel to Turkey and Istanbul with my wife, please consider watching that and consider subscribing to catch next week's episode. The process is simple. Miniature punches, little